my name is Shayla, and we're going to be talking about Crohn's disease. So you might ask yourself, what is Crohn's disease? Crohn's disease is a type of inflammatory bowel disease that causes inflammation of the digestive tract. What is the pathophysiology of this disease? So Crohn's disease is a crypt inflammation, which is considered ulcers in your digestive tract. These mucosal lesions may develop into deep longitudinal and transverse ulcers with intervening mucosal edema, which is swelling, which cause this appearance inside a person's bowel. Diagnostic testing. So there are many tests that can be performed on a patient to determine if they have Crohn's disease. So first, one of the main ones that they could do is a blood test to check for anemia and infection. And then stool. So a stool study might be performed to check if there's blood, parasites, infections, any organisms or anything that is abnormal that could be present in a patient's stool. Colonoscopy. This is used to visualize the gastrointestinal tract and the affected areas where the lesions could be. And then a CT scan could be done of the digestive tract, an MRI, and a capsule endoscopy. So clinical manifestations. So you're going to see this picture here. This just gives you more of a visual. So some of the signs and symptoms can include diarrhea, fever, fatigue, abdominal pain or cramping, blood in your stool, mouth sores, reduced appetite, and weight loss, pain or drainage near or around the anus due to the inflammation from a tunnel into the skin, which is your fistula. Treatments and medications. So there are many different treatment options per se that a person can take when they have Crohn's disease. So medication for Crohn's disease is designed to suppress the immune system from the inflammatory response. So patients can take aminosalicylates, which will help with the inflammation. They can take antibiotics, biologic therapies, corticosteroids, or immune modifiers. Some non-prescription methods that they can do include antidiarrheals, pain relievers, supplements including iron, vitamin B, calcium, and vitamin D. Surgery can be an option. It is typically the last resort. However, there is no necessarily cure for Crohn's disease, and surgery is not a cure. It's important for patients to understand that. They could even do a lifestyle change. And a lifestyle change could include their diet, exercising, just watching different things that they're putting in their bodies. Okay, the nursing process. So the nurse wants to assess for a fever and weight loss. This will help establish how aggressive the disease is. Ask the patients about extraintestinal manifestations involving the eye, joint, skin, and oral cavity, which will help how severe also the disease has gotten. All right, patient teaching. Patient teaching is extremely important when it comes to Crohn's disease. So you want to tell the patient to avoid problem foods. Problem foods can include caffeine, alcohol, and spicy foods. These all can make the symptoms worse. Spicy foods will irritate the digestive tract, which can ultimately cause more bleeding because you are irritating it. Reduce dairy. Those with Crohn's disease, they often see decline in abdominal pain, gas, and diarrhea when they limit their dairy. This could also be a sign that they are lactose intolerant, which that means that someone is someone's body has issues trying to digest the sugar that's in dairy products, which is lactose. Avoid high-fat foods. Those with Crohn's disease, their small intestines most likely don't digest fats normally, so instead they absorb the fats, which it passes through, and it gives you diarrhea, which can cause worse symptoms. Limit fiber. Fruits, veggies, and whole grains are part of a healthy diet, but can cause discomfort and inflammation in the bowels. Avoid large meals. Drink lots of water. Fluids are an important part of the digestive tract, and water is the best choice. Something else a patient can even do is visit with a dietitian. A dietitian is a great way to get resources and information on what kind of foods you can eat as a person with Crohn's disease. So they could help you create different meals so you're not eating the same thing, alternatives. You don't have to eliminate everything or eat a bland diet. There are always options out there that you can do. You just might need those resources available for you. And then all of the images I used, here are the little references. And that is my presentation on Crohn's disease. Thank you.